Good afternoon, sir. One more minute. Now it is good afternoon. All right.
My timing's good.
Yep.
Good afternoon. My name's Eugene Brown. I'm from Charleston. Thank you for having me. Thank you for your time and your sincere interest in medicine. I've been very impressed by some of your deep questions and insights into the healthcare problems that we face on the front lines on a daily basis. I'm speaking to you today representing the Society of Otolaryngology and Head and Neck Surgery in the state of South Carolina. I'm also the president of my group, which stretches and spans most of the state, which is Charleston Ear, Nose, Throat, and Allergy. Our group and the groups that we manage beneath us compose 40 ENT doctors and nearly 20 audiologists. For you to gauge that, that's about 1/3 of the ENT doctors in the state. So we work very closely with audiologists and speech therapists to deliver quality care. We are a team working together. We identify the patients that need the correct services. Federal and state laws and regulations define our roles and how we work together. Historically, the physician has been the head of that team, and our referral is needed for some of these patients to be seen in some of these instances. The state has adopted several compacts that we are all aware of within the state, but there are a couple of things about this compact that we find discomforting. First of all, has been touched upon by several people, is that the compact supersedes all the laws in the member state that are in conflict. None of the other conflicts that are in place in the state have language that aggressive. Secondly, the compact outlines a commission that is yet to be set up and functional, at least by my understanding, and whatever the commission says is expected to supersede law and become a directive to be followed by the state. The concern is that the state's hands really are tied. I know that there's some window dressing that's been expressed today, but if you take the time to read the statutes, the language is more aggressive than what's being said. So we have concern that it creates somewhat of a slippery slope in how this may play out. Further, the compact contains a provision that requires member states to recognize the right of audiology and speech pathology to provide telehealth services. Back in 2016, there was an extensive debate in the General Assembly to outline the way telemedicine would play out in the state. There are lots of regulations that define how this is to be employed, and it outlines a lot of oversights so that the service is rendered in good faith and there's no room for abuse, and oversight is defined. Our concerns are in this compact that there is a lack of oversight based on how it's written. It clearly says that telehealth will be required by the member states. There are other concerns about the language and how that might affect other instances. If we have to defer to the commission on what they come up with in terms of rules and provisions, how might that affect reimbursement? Could that ultimately lead to rate setting? Some of these services aren't outlined in terms of Medicaid and Medicare and even commercial insurances on how they're going to be reimbursed. And the appearance is that the compact has the ability to potentially influence these rates without state oversight. There are other concerns. The scope of practice concern is raised in this instance. Currently, audiologists require a referral from an otolaryngologist to see patients who have Medicare coverage. It is not a secret, and it's clearly laid out on their website, that they seek to do away with the need for that referral. The reason that these that these steps have been enacted is that the doctor is the head of the team, and it is important for the doctor of hearing to evaluate some of these patients to make sure they don't have a different medical condition that might be missed otherwise if the diagnosis is centered solely on a hearing test. So there's concern that some of this historical hierarchical approach as defined by federal and state provisions and statutes could be bypassed if the compact is given the freedom to enact and change some of these different line items. As I noted, the commission is not operational, as we don't know exactly what it will mean when they come out with policy. To me, it seems a little early to be considering the adoption of the compact. Why don't we have this information at the table before we're making a decision on something that it will be difficult to reverse? It sounded really easy when prior speakers were saying that it's easily reversed, but no, it has to pass through the House. It has to pass through the General Assembly. And then if you can pass it through, there's still a 6-month window before you can withdraw completely. There are a lot of concerns on a national level. It seems that the compact has had very little interest in dealing with the otolaryngology specialty to consider our input into this document also. We reviewed the document at their request and submitted lots of information, and there was no back and forth and none of our suggestions were taken. The concern is that it's a little bit unilateral. I'm worried that it extends a reach that may not have proper oversight. Thank you for your time. I'm certainly available for any of your questions.
Thank you, Dr. Brown. I think I see Senator Corbin has some questions.
Okay, thank you, Dr. Brown. So what I'm hearing from you is that the commission is going to draft policies to guidelines to go by for the compact, and that has not even been done yet. Is that correct, what I'm hearing you say? I mean,
I'm not sure the commission is even completely formed, but what the commission comes up with is to be agreed upon. The state's giving up oversight of whatever the commission comes up with.
that's what I want to talk to you about.
There's no state oversight. If the commission decides that this is going to be done, then the state's obligated to follow this, given the verbiage in the compact.
Well, that's what I was getting at. I mean, we're entering into a compact whose policies, rules, and regulations are not really put forth yet, and yet once we're in that, A, it's difficult to get out, and B, it supersedes state law. Is that what I'm hearing you say?
That is my concern, sir.
Okay. Mr. Chairman, at the appropriate time, I would love to hear somebody's opposing argument to that. Thank you. That's what I understood from you, and thank you for that.
Other questions for Dr. Brown? Senator Brett Matthews.
Dr. Brown, thank you for expanding your practice throughout the state. We really appreciate it. I was riding through a section of Beaufort the other day, and I saw that y'all have an office there also, which is great. And so I value everybody's testimony before us, but here I think you made it well known that your office is throughout the state of South Carolina, and that there are how many doctors in your practice?
We have in the ballpark of 40.
Okay, and so what I see is sort of like what Senator Davis talked about earlier. Was there everything we look at? It deals with a balancing. So you're in Charleston. I think one of your biggest offices is in Charleston, and as well as now I see that you're in Beaufort, and you could have been there a while, but I don't go through that part of Beaufort a lot. One of the things that we keep hearing is access to care And Beaufort and Charleston are the two of the counties that we have a lot of transient folks that come in, partly due to other medical professions as well as the military. And one of the things this compact would do is it would allow you to have more access to, say, someone that, if we're in this compact, say, is coming here from California, or moving to Beaufort from California, or to Charleston from Florida. It would give you access to someone that doesn't have to wait to be certified in the state of South Carolina. That's one of the balancing things I'm sure you thought of when reviewing this legislation.
It just hasn't been a problem.
Okay.
We've not had a problem with recruitment nor with licensure.
Okay. And so to you, that weighs very low in the balancing test we talked about, correct?
Correct.
The other question I have is a little bit different. You stated the no state oversight, and I think Senator Corbin has gotten into that, so I'm not going to replow that part of the field. But what perked my interest was when you said, where was there that your involvement or the involvement in reviewing the legislation and putting forth suggestions regarding how we would have to change present South Carolina law in order to enter this compact. What were your suggestions specifically? Did I miss what you were saying
It was
when you came to the table?
based on how the compact could be repealed, we could get out of the compact?
Yes, yes. Say, your concerns were, I think it was you said it was too unilateral, didn't you?
Correct.
And so, and then you talked about your involvement in reviewing the proposed changes. And then you said there was a list that was put forward and that was it, nothing was done.
Oh, that was at the national level. I'm on
Okay.
the board of directors for our national academy.
Okay,
And while we were included in reviewing the compact on the front end, there was no engagement by the individuals drawing up the compact to consider any of our input or feedback to the compact.
how many, thank you for clarifying that.
Right, that's
I
our
thought it was-
national organization that represents 12,000 otolaryngologists in the country.
I cannot say otolaryngologist.
It's a mouthful.
Because I'm a lawyer, so whatever. But anyway, yeah, I noticed that. I can spell it, but I can't say it. Quick question. How many states are presently in the compact? None? It's
No,
just
I thought there were 10, but someone earlier said 15.
15 states are in the compact. Where are they primarily located in the U.S.? Do you know?
I do not know.
So with 15 states already in this compact and no commission set up yet or functional yet, what's your concerns regarding that?
I don't understand how that can happen.
And when did this compact idea start? In other words, did those states recently form this compact within the last 5 years or 10 years or longer than that?
I don't know the time frame specifically, but I know it's been over the course of the last couple of years.
When everything was pretty much shut down anyway because of COVID, right? Okay. I think you've answered my questions.
Other questions for Dr. Brown? Thank you, sir, for taking the time to share your
Thank you
thoughts with
so
us.
much.
Does anybody else sign up to speak?
We have one other individual signed up to speak, and also Katie is here from LLR, if we want to hear.
Is that Katie or Holly?
Yeah.
I see back there. Katie and Holly?
Oh, I see. You want to come on up, please? And I think what the committee might be interested in hearing is the interplay between state jurisdiction and commission jurisdiction, and what authority does the state retain in the event we decided to enter into a compact?
Well, good morning. I'm Katie Phillips with LLR, and I might need a little request for repetition on to what that question was, and I will certainly do my best to answer them.
I think the general concern is, and again, and I understand it's almost like with scope of practice, you're talking about a balancing of the level of quality of care against increasing access. In this context, it would come up in the context of what control or sovereignty or jurisdiction is the state ceding in return for increasing the mobility or the access or portability of professionals that operate within the compact. So I think just in general, in terms of how we go about assessing as legislators those trade-offs, and at what point do the benefits of joining the compact, outweigh the retaining of sole jurisdiction? If that makes sense.
Your question makes sense.
Okay.
I'm trying to figure out if that's something that I'm capable of answering here. I know that, so there are a lot of different compacts, and certainly the agencies and the boards, they understand the need and desire for increased portability. There's lots of different ways that can be addressed. Compacts is one way. And with the different compacts, they're set up differently. I know there's been discussion about the PT compact and the nursing compact, but just for clarification of how those work and may or may not be different to the other compacts you'll be considering is, so for example, with the nursing compact, the board doesn't know ahead of time that a nurse who is in that compact is coming to the state. We typically know if someone files a complaint, then we would know that they are here. But just because of the way that structure is set up for that compact. With the PT compact, that legislation passed, but the state is still waiting for, at least as of earlier this week, something may have changed between then, but the state is still waiting for that federal FBI number in order to process the fingerprints and to become effectively participating in that compact. So these do take some time even after they pass. One of the things I think that was discussed and gets to your point is the commission rules. So the way all of the compacts work, to my understanding, is that once the commission is formed, and I think they have to have the 10 member states, and it sounds like the speech is in the early formation of getting those members together, they will come up with the bylaws and the rules, which are kind of similar to a regulation, but it would be the commission that comes up with those. And those, my understanding as to how this is written, those would be binding on the individual states. And so each state would have, I think it's typically 2 representatives be part of that commission, each of the member states, and they come up with whatever rules that they want. So there is some participation, but it would be 2 members heading there. But the way I understand the compact is you would have to pass legislation in order to decide to get out of the compact.
Senator Corbin, do you have any particular questions for Katie in regard to the compact and how it would operate in this aspect?
Well, you answered our questions and very well, and I appreciate it. Are you allowed to give an opinion of LLR?
Well, I don't know that LLR necessarily has an official opinion just yet. Like, so, for example, as I mentioned, each compact is different, and I think you have to really look into the details. And for compacts that are not set up yet, like this one where we can't look to the rules. So from the agency's perspective, which would be a little bit different from the board, from the agency's perspective, we're looking at the administration. And so with any compact, there are questions that we don't always know until those rules are enacted. So the compact has the ability to charge fees to a state, what would those fees be? How would they be charged? Who would they be charged to is a typical question. And that, in this case, we don't know. Some compacts allow the state board to charge fees to those compact applicants. I believe this one would allow that, but we don't know what the compact fee would be for those applicants or what the state would be allowed to charge for those applicants to get that, participate in the compact. With this one, currently this board does not require the criminal background check for fingerprints. For these licensees, that would be a process we'd have to establish, which we do it for other boards that have that in statute, but that would just be a new process here. And so it's really just knowing what this is ultimately going to look like. I know there were questions about how the renewals will work, and my understanding is a lot of the details will be put in those rules, And so we may not know ahead of time exactly what those rules are going to say because they haven't been established yet.
Okay, thank you. A question. Currently, the audiologists are licensed in South Carolina, right?
Yes.
Do you know how much the licensing fee is?
I did not bring that with me. I could look it up.
Well, okay, but the LLR retains that to operate off of, right? You are tasked with operating basically off your income from fees and things, right?
Yes, we're 97, 98% other funded as an agency. So those are the fees that the licensees provide would fund the functions
If
of
we
the
enter
board.
this compact, will you still be able to retain the licensing fees from?
The way I understand it is if the board in the rules is allowed to charge a fee to those applicants, that would stay with the state. But there is, and different compacts have different rules. Not all compacts allow the state to charge a participant a fee. I would need to look back and see what.
So potentially you could be licensing these folks without a fee going to South Carolina for your efforts.
In this one, I do believe it does allow the state to charge a fee. We just don't know what those details would be. I'm unclear if it would need to be through a state regulation or if that's something that can be done through the commission and then sent down to the agency. Part of it is we hear how the PT is supposed to work, and we can talk to other states and we can talk to the commission about how that should work. We just haven't been able to fully participate yet, so we don't have that as the experience to be able to rely on to look to say, okay, this is what this looks like.
Thank you. I have no further questions.
Senator Bright Matthews.
Sorry. Have you had an opportunity to look at the changes that we would have to make in our existing law in order to be able to join this compact? And if so, are any of those changes substantive that would give you concern?
That I'm not entirely sure how best to answer that question or if I have enough information to do so. So the way I believe this compact is written, and I'm flipping through to see it now, is it just adds in a whole entire section. I don't believe it is, unless the fingerprint part does. I would need to double check that to see if it is changing any of the existing compact or existing statute outside of adding in this compact language.
Okay, because a lot of it seems to be adding in the audiology or speech language pathology and all of that. I just, when I perused it real quickly, I didn't see anything too substantive. I just wondered if you had any, or the agency had any problems with it. If you find that out, please let me know. The other question I had was, would we be negatively affected as a state if we chose not to enter this compact, but to wait and see what other states, what the commission would look like, or the rules would look like once the commission, or the bylaws, excuse me, not rules. The bylaws would look like once the commission is established?
And I'm not sure that is a question that we could answer at the agency level. Certainly, if the state chose to wait till the bylaws and the rules were established, then you would have more information. But typically, my understanding is also on the other side of that is there's an idea of what they think it might look like, or if it's going to be modeled after an existing compact, which compact rules those might be. But ultimately, until they're actually passed, you won't know. So that's really, where is that, as Senator Davis said, where is that balancing that you as the policymakers want to feel comfortable?
Likewise, we may not have a seat at the table in establishing the bylaws. If we don't, the other side of that is if we did not join the compact early on, we would not have a stake in having our voice heard as to what the bylaws in this commission, correct? Is that the balancing act once again?
I would defer to the Council of State Governments folks as to how that process actually works of when the member states get to participate as far as establishing the bylaws, and if I'm just not familiar enough with their process of when that begins and when the states get to participate, but my understanding is once the state is involved, they would be involved going forward. So if rules were already established, they would be involved in that point forward. But I'm not sure I have enough information to answer that question.
May I ask the chair?
Senator Bright Matthews.
Or Mr. Hogan, a question. What states, do we have any information on what states have already, have I missed that?
let's
Did you
go-
talk about that?
Yeah, let's go to Mr. Logston. Is he live with us here? You can hear us, sir?
Yes.
Did you hear the question that Senator Bright Matthews posed about the member states?
Yes. So
Okay.
currently, I can give you a list. New Hampshire, Maryland, West Virginia, North Carolina, Georgia, Alabama, Louisiana, Kentucky, Ohio, Indiana, Oklahoma, Kansas, Nebraska, Wyoming, Utah, and Colorado. And we're on the governor's desk in Mississippi. And there's still pending legislation in Tennessee, Iowa, and Idaho.
Thank you.
Senator Bright Matthews. Senator Corbin, question for Mr. Langston.
One question. At what point, you've got 16-plus states in the compact, at what point are you going to draft your bylaws?
Yeah, the commission met in January, and it drafted bylaws. It passed a set of bylaws. It's now working on all the commission rules. The executive committee meets on April 1st to adopt some of those rules, and then the commission will ratify that in early or mid-May. I forget the date. So the commission's operating and meeting currently.
So you're
Starting in
very
January.
close to having a document for us to look at to review for the governing bylaws. You're very close to having that produced.
Yeah, I mean, there's bylaws posted on the website. There's a code of conduct. There's a description of the timeline. So there's information on the commission website that we can get to staff.
Okay, thank you so much.
Okay.
Mr.
12
Chairman? Oh, go ahead.
No. I was going to say it's 12:30, and I want to be respectful of time. I know we go into session at 1, and some may want to have lunch. What's the pleasure of the committee in regard to this bill? Senator Bright Matthews.
I would move that we carry this over and get some additional information, like the bylaws and the commission, and see where we're going, and just take this up at the next meeting.
Okay. Senator Corbin.
I don't know how you need to handle this. It would be, is this a Senate bill?
It is a Senate bill.
We're up against a crossover deadline, and I have many questions as well. It would be my suggestion to let's pass it out of committee with everybody reserving their rights, because things can be held on the floor and amendments can be made. Well, this particular thing I don't think can be amended, but decisions can be made on the floor. It would be my pleasure to move the bill forward to full committee.
Senator Bright Matthews, how do you feel?
I don't have any problems with that.
Okay.
I'll withdraw my motion.
Okay. Is there a motion for a favorable report?
So moved.
Second?
Senator Cash will second it.
Okay, any discussion in regard to a favorable report with all members reserving their rights at the committee and on the floor?
No.
Okay, proceed to a vote. All in favor say aye. Aye. Opposed? And the bill will be favorably reported out. I thank everybody for their attendance. We'll stand adjourned.
What did we not have?